which is too much to go into here, but there are just a million ways for them to funnel money to doctors and to and to executives. So this is an example. Oh, and by the way, their board members included, former Microsoft executive, the biggest department store in town, the chair of the theater, and this is typical of these folks. Okay, that's a big issue. Okay, here's a radio brethren, John Ryan from Puget Sound, looked at $1 million doctors in the Seattle area using 990s, and it was fun. It was fun working with him on this because he really dug into 990s, and I know how difficult numbers can be on radio, and he really had a way of finessing that. And he also had a nice tip at the bottom, which a lot of times when you get the 990, it's a PDF and you can't search it. And here's a website you can go to, and you simply log on there and call up the file, and it gets converted into a searchable PDF. You can search it. So he's adding to our knowledge of the 990. The final document I want to tell you about is the Medicare cost report, and what's great about it is it gives you a lot of financial information about not only nonprofit hospitals but for-profit hospitals, and they can be a little harder to penetrate, the for-profits. But this is a great document to do it, and it's a very complicated document. And there are companies that buy this, that buy this as their business, and they will work with reporters. I have some examples at the bottom where my cursor is: costreportdata.com, ahd.com, Solution. A lot of the hospital. Charlie talked about the importance of data, which I really agree with, and for this case, I would recommend you, if you were to go down, try to get your Medicare cost reports on your hospitals, you really need someone to help you in the beginning. And although I'm a big fan of doing the work ourselves and doing it eventually, but I'm just telling you this is a big mountain to climb. Here's an example. I love what this guy did. He actually used, I think it was AHD, one of the companies, American Hospital Directory, and he pretty much determined, using fields on the cost reports, he determined who were the highest profit margin hospitals in the country, and a bunch of them turned out to be for-profit hospitals, and 45% operating margin. I mean, that is just unbelievable. I mean, even organized crime wishes it had an operating margin of that magnitude, and it's a very, remember I said in the beginning, like most hospitals are 1 to 5% operating margin, and that would be profits over revenues. Profits as a percentage of revenues, but to make 50 cents on every dollar or 45 cents on every dollar is just unbelievable. And if you have a hospital like this in your area, they are ripe for a deep look. Here's another example of using Medicare cost reports for malpractice, which is not as big an issue now as it was a few years ago. So we're going to skip that. And this is just a point that, okay, hospitals are getting more important all the time, and their numbers are going up, and the health bill is huge for them. And even if it gets repealed in part, it's likely that most of it will not get repealed. And there are huge effects in that bill for community hospitals. And one of them is to conduct a community health assessment every 3 years and report back about how they're improving care in their area. That would be a really interesting story. And certainly another issue is, how much do they charge people who are uninsured? A lot of hospitals were charging them higher rates than people who were insured, believe it or not. And it was a big story. And now everyone's supposed to charge poor people or uninsured people, a very low rate, like the Medicaid rate plus maybe 10%. And whether that's going on in your hospital would be very interesting. I mean, there are some hospitals are very aggressive in their legal department and going after people who owe them money. And it's really interesting to be done by your local nonprofit hospital. Quite an experience from people I've talked to, and it makes for a very interesting story. And I'll just close with one example, and this is the Wisconsin reporter who used some of these documents, and mainly the 990, and looked at the issue of charity care and how much hospitals are giving back. This is really the core question with nonprofits. Are they giving back what they should? And he was able to analyze that Wisconsin hospitals are giving a far lower percentage of their expenses than was typical nationally or in other states. And here's one last story, and then I'll stop. There are patients who spend months and even years in the hospital, and they get dumped there. And it's really a financial story because they typically tend to be illegal aliens, and they don't have citizenship, and so therefore aren't eligible for Medicaid. And they can't get anyone to pay for their care, so the hospital is stuck with them. They're like a hot potato that nobody else will take. And so we had this one case of this guy in this Jersey hospital who spent 10 years there. And the only reason they got him out was they finally hired a lawyer and got him citizenship. And it's quite amazing. And this happens in hospitals it's virtually in every hospital. And it's kind of an amazing story if you find a case like this. And the frequency appears to be rising. So with that, I will stop, take any questions, and go on.
Okay. Thank you, Carl, very much, and Charlie as well. I'm going to go back in. I've got contact info for everybody for you. Just let me zip through since I can't find it. And we'll get to questions in just a second. A reminder that there is a question box that you have, and you can open that up and write a question in, and I'll ask it of the guys. There's Charlie's contact info, Carl's contact info, and mine as well. Naomi Serban wanted to ask, she wanted to make sure that you're going to have access to the slides and be able to print the information when the webinar is over. And yes, we've asked them for copies of the slides. They'll be at the PRNDI website, so that you'll be able to go back through, because I know there's a ton of information in there and a lot of great links and names of articles that you want to check out. One of the first questions that's come up comes from Angela Hatton, who's at Murray State, and she asks, it was a question for Charlie, although I think Carl could answer it as well or address it. She writes, data can be subjective. How do you ensure that the organization you're getting your information from is presenting data that's not been skewed? Guys, you want to take a crack at that one?
Yeah, I think that what you want to do is make sure that it's sort of viewed by impartial experts as legitimate. I mean, I think data that's been out for a while, like the Medicare hospital compare data and the transplant data, is widely embraced by the community. I mean, the American Hospital Association endorses the hospital compare data. The Transplant Association endorse the transplant data, the data about the discipline of health professionals. We put that together ourselves based on the number of health professionals that were disciplined. But you are going to have marginal organizations saying, oh, look, this is a good hospital, this is a bad hospital. You have organizations like Health Grades that will not disclose their methodology. I tend to feel if you're not willing to disclose your methodology so I can have somebody who's an expert look at it, then I'm not going to write about what you have to say. Because in this era, I just think proprietary methodologies, we're past that, and there's enough that's been made public that I don't want to write about you if you're not willing to show me how you come up.
Yeah, I would add that a lot of this data is the hospitals reporting to the government, and it's not just an idle report. It's like a promise. Like they're putting it out to the government that this is true, and what's on their 990 or what's in their Medicare cost reports or even the quality measures that Charlie talked about are going to Medicare, and so if they're wrong, they're liable for a whole bunch more problems. So they really tend to be okay. But that said, it's a good question, and I think you really always should test your data and see if it makes sense, and see if if there's too much going on one day, for example, that might be a tip or something. But I would test it and talk to people. As Charlie said, never ever just run a data set and run it into the put it on the radio. Always test it. Always talk to people. Always go and check out its context and how it was derived, because there are mistakes in data. That's true too. And
what Carl said. I mean, what you said, Carl, about how these people are reporting it themselves. If you go to them and they say, no, this is wrong, well then, why are they submitting wrong data? I mean, do they not care about it? Do they not take it seriously? So it doesn't excuse them from the story. It may make it a different story or a better story, but it doesn't excuse them.
Okay. Grace Hood has a question. She wants to know, once you've gone through the data and you found your story idea, how do you go about finding sources who have been impacted by a trend? Are you hanging out next to the hospital entrance? She says, please give me an example.
Well, is there a story you had in mind? Is there stories you had in mind that we could talk about specifically?
I don't know, Grace. If there's a story that they brought up, just type it into the question box, and I'll relay that. But I'm wondering, it does kind of go to the question that I had, which is, we have this sense of investigative reporting being, somebody called you with an off-the-record tip, or somebody's pissed off about treatment they got, and you pull the thread that way from the personal story out. But you guys seem to approach it from the data back. So if you're approaching it from the data back, how do you find the personal stories that illustrate it?
Well, I'll take a stab at that. I mean, certainly it's not just from the data back. I mean, I think you need to work both ways. And let's take Charlie's transplant story. And let's say you have a lot of deaths at a hospital. And so, okay, and you just get a number from UNOS, which is just a raw number. How would you go about finding? You got to find cases. I mean, first rule, find people, find cases, find their stories. So I might look at, death records in the medical examiner's office about cases that went through there, or I might look at lawsuits and try to figure out, has anybody sued them? Any transplant cases sued? Has there been any suits that might give me leads I might hang out at the hospital in the the dialysis ward. That might be an
obituary.
Obituaries. Go ahead. Go ahead, Charlie.
No, that's where we got a number of names through obituaries.
Yeah, I think obituaries are really interesting because you get the rough time of death, the date, and you get the cause, and sometimes you get the cause, and it just leads you to more cases. And then I think talking to people in the community, like people who are, in the system who are experts. I mean, or patient groups. I mean, patient groups have their ups and downs, which we can talk about, but they can certainly help you find people.
Okay. Naomi Starobin asks, in which report would she find information on patient dumping of illegal aliens, and is there a specific trend that she should be looking for when reviewing the data?
That one would be a tough one to find in a document, unless they had a systemic problem on it. That would be one that, I'm a big fan of hanging out in hospitals and doing a lot of stories there and meeting people and sort of learning. And just doing some basic stories there at first, where you deal with the nursing staff and they say to you, this gentleman in room 10A has been here for 6 years and he gets his mail here and he seems to be, like it's his apartment. We heard about one case in Philly because, we had a reporter who was going to that hospital every day and doing stories. And he heard about this elderly Korean woman who, her daughter had married a U.S. GI in Korea, and the daughter came over here to live with him, and they broke up, and then she brought her mother over, who was not a citizen, and she was fine for 20 years, and then got sick, and they heard the hospital would take care of sick people, and they dumped her at the ER, and then were real huffy about taking her back, and it was really emotional for the family. I'm sort of being flip here a little bit, but because they were like guilty at the same time. So I don't think there's any kind of great data that will say here's your people dumped. But I think through sources, through a little experience, I think you can find them.
There is some data, Carl, in looking at. There's a law called EMTALA, which prevents hospitals from dumping patients. So the inverse of what you're talking about. And if somebody shows up for emergency treatment at a hospital that is an emergency room, the hospital has to treat the patient. And sometimes hospitals will do what's called a wallet biopsy, where they will see what your insurance is and determine whether they'll treat you or not. The federal law prohibits that, and the Centers for Medicare and Medicaid Services, which is the federal agency that administers Medicare, will investigate complaints. And every Medicare regional office, state health department, has reports on what's called EMTALA violations. And if you request them, you'll be able to see what hospitals in your area have been cited for patient dumping, not the type Carl's referring to where a family dumps the patient at the hospital, but where patient dumping in which the hospital is unwilling to provide care to a patient in it.
Okay.
Yeah.
Sarah McCammon, go ahead. Did you have something to add, Carl?
No, just that ERs are sources of great stories and I'll give you an example. I mean, ER use is going up all over the country, roughly, and what Charlie was talking about was whether a hospital will treat an uninsured person or not, and that's one issue. ER wait times is another one. We just did a story that looked at there are a number of hospitals in our area that are posting wait times on the web.